Are you unable to escape from all the negative thoughts that are circulating in your head and that is making you feel stressed and you feel weak and exhausted? Hello, I am Rajitha Bommakanti, registered nurse, faith-based holistic coach, and founder of Healthy You Lifestyle Center. If you want to develop healthy habits for life, one step at a time, click the red subscribe button and the bell icon now. Today, I am going to be talking to Dr. David Hanscom, who is a well-known orthopedic surgeon, and he is on a mission to bring the known chronic pain solutions to public awareness. He is going to explain how the negative emotions cause stress and the stress affects your immunity and your overall health. Hello, Dr. Hanscom. Welcome aboard. Thank you for joining us today on your busy schedule, coming and talking to us. It is my honor and privilege to talk to you today. Dr. Hanscom has been my first champion when I came up with this thought process about doing this health summit. You have been encouraging me a lot on this. Thank you very much.
Yeah, absolutely.
And wanted to ask you, Dr. Hanscom, you are a neurosurgeon and have been doing surgeries for a very long time. And from that, you shifted to the doc project that you have. You're actively, talking to people about how to live healthy without surgeries, managing pain and stress. What brought your interest into, shifting from surgery to the doc project?
Well, first of all, I'm actually an orthopedic surgeon. So the reason why people confuse me with being a neurosurgeon is that I'm an orthopedic spine surgeon.
Okay.
So I specialize in spinal deformity like scoliosis, kyphosis, and major deformities. But I don't do neurosurgery. And what happened, I came from a very high-level spine fellowship. I spent my first 8 years in practice aggressively doing surgery. And like every other surgeon, you're sort of trained that if everything else has been done, then we must do surgery. And we feel sort of obligated to do something. It turns out that in back pain, I did fusion after fusion after fusion for back pain. When the data started coming out, it turns out that the success rate for a spine fusion for back pain was only about 30% or less. And that happened in 1993, and I just stopped. And I simply stopped doing spine surgery for back pain. I didn't know what to do. In the meantime, I dove into my own chronic pain issues for about 15 years. And I couldn't figure out what happened. I went from being a fearless surgeon to a panic attack in one day.
Wow.
And I did not know what happened. So I thought it was psychological. I thought anxiety was psychological. Turns out that I probably had what's called a cytokine storm. Turns out that what happens is that the essence of pain is threat versus safety. The reason why I quit doing spine surgery, it turns out that we're operating on anxiety, and it's actually a physiological process, not psychological. And what happens when you're faced with a threat, whether it's a mental threat or physical threat, your body says danger, then the sensation generated is anxiety. Just like you're lying on the beach in the sun, thinking about the good life, you're relaxed. You're relaxed is just a state of being, which is safe cytokines, oxytocin, dopamine, all these great chemicals. But relax is a description, not a diagnosis. It turns out that anxiety is the same thing. Anxiety simply describes the state of your body's neurochemistry when you're under threat. Jumping ahead a little bit, the essence of solving the problem is feeling safe. The essence of the problem is feeling threatened. And what happens is that mental pain is a much bigger problem than physical pain, because if something hurts you, you can leave, turn around, walk away, problem solved. Then you go back to being relatively normal. The problem with negative thoughts is that you can't escape them. There's been lots of research done on unpleasant, repetitive thoughts. And so you're assaulted with these thoughts on a regular basis. Every human being has this problem, every one of us. And so when you try to repress them, that's also even a bigger threat, because we try not to think about something, you think about it more.
Mm.
So it turns out that what happened to me is that I became a major spine surgeon by being an absolute master at suppressing everything. So I was tough. My attitude was bring it on. And I did. I was literally, people thought I was fearless. I thought I was fearless. And what happens, I was just a master at repressing stress. And at the same time, I was also negative on myself by being a perfectionist, which has always been self-critical. So the whole drive to the top was based on repression and being negative. So then I was driving across the bridge in Seattle when I was 37 years old, and I had a panic attack. And I honestly did not know what the sensation of anxiety was. And it blew me away. So I spent the next 15 years trying to solve the problem, which kept getting worse and worse and worse. Turns out that the sensation that we call anxiety is your body saying danger. You get the surge of adrenaline, cortisol, different stress chemicals, and you get inflammatory cytokines going on. It turns out that the basis of anxiety, depression, mental health disorders, physical disorders is all based on chronic inflammation. All of it. It turns out everything's the same thing. In other words, the body's going to react to a threat. Once a threat is solved, you move on. Again, humans have the problem of being faced with negative thoughts that they can't control or suppress. So that's when people under chronic stress, I use the word stress is a physiological term, not psychological. But again, under chronic stress, your body's under chronic attack from inflammatory cells, your immune system.
Oh, wow.
And it tears you down.
Yeah. So that is very, very interesting. Now, for last couple months with the COVID and all that, that's all we hear in the news, because people are in tune to the news, and you hear all kinds of negative stuff, about not enough PPE, people dying, and all that stress and anxiety building up in people. How does that affect?
It's bad. I just wrote about a 20-page document that I'll send you here shortly. It'll be done today or tomorrow. And I outline 10 different areas that you can actually decrease your cytokines. So what kills people, so to end the pandemic, you have to quit spreading the virus, right?
Mm-hmm.
But there's another way to end the pandemic, because we're not going to get a vaccine very soon. We know that the social things we do help, but they're not really going to get rid of this virus. And so most of us are going to be exposed to the virus. Most of us, of course, are going to survive. But it's such a bad actor that for us to get herd immunity is going to take thousands and thousands of people more to die. And we don't really want that.
Wow.
The other way to end the pandemic is to survive. In other words, you can save people's lives by altering the cytokines, then the pandemic is also over. I mean, the problem isn't getting the virus. We all get common colds and the flu and whatever. The problem, of course, is the seriousness of the illness. So what we've come up with, there's a Dr. Stephen Porges who wrote a book on polyvagal theory starting in the mid-1990s. And he's a genius based on the autonomic nervous system, the vagus nerve. But what happens when we're under threat, we have this inflammatory response. In other words, every day your immune system is picking off bacteria, viruses, fungus. When you brush your teeth, your bacteria are picking those things off. When you have cancer cells in your body, your immune system takes those away. So your immune system is this ongoing gatekeeper for invaders. So what happens with the COVID virus, your body becomes exposed to a threat. And I'm going to use the word threat in general terms, because remember we talked that a mental threat and physical threat are processed the same way. Mm-hmm. So that's why chronic stress, in other words, a chronic mental threat, has the same reaction as the COVID virus, because it's a threat. The effect on the immune system is the same. Now, I'm going to talk about the acute threat in COVID virus, because what happens is you have the virus, then your body secretes all sorts of inflammatory markers, even angiotensin, an inflammatory cell. You have what's called cytokines, interleukin-6, interleukin-1. There's different cytokines, and these cytokines are little switches all over the body. They're small proteins. They're manufactured in every cell in the body. And so anytime you're under threat, these cytokines are causing your white cells to be more and more active and cause tissue destruction. So it turns out that Alzheimer's, depression, psychosis, heart disease, cardiovascular disease, peripheral vascular disease, adult onset diabetes are all a result of the inflammatory cells actually destroying tissues. Now, with the inflammation, people say, well, inflammation, no big deal. But if you have ever had a boil, you'll notice that there's the raised elevation of the boil, but there's also a cavity where the tissues are destroyed. Inflammation destroys the bacteria. It also destroys the local tissues. For instance, when we have an infection in the spine, often the reason why we have to do spine surgery is that the spine is completely destroyed, just like a tumor. So what inflammation does, it actually destroys the invaders, but if it's out of control, it starts destroying the normal tissues. For instance, lupus. Systemic lupus is an autoimmune disorder that destroys the whole body. So it destroys the heart, the lungs, the kidneys, and at some point people die pretty early from lupus. Or take ankylosing spondylitis, another inflammatory disease, is that you develop inflammation all over your body, and then your body reacts to defend itself. So in ankylosing spondylitis, your entire spine turns into a solid piece of bone. Well, that doesn't just happen as a response to a threat. So chronic stress creates chronic inflammation, creates chronic disease. That's not psychological. Even though there's mental input, you can call it the psyche if you want, the actual effect in the body is not psychological. Let's go back to the COVID virus as another threat. It happens, of course, much faster, but it's the same sequence that the virus comes into your body. You're now exposed to it. The reason why, and viruses are odd because they're not dead, they're not alive. They're just little packages of proteins that get into the cell. They don't come alive until they become into the cell. And even then they're not alive, they simply alter the function of the cell. It turns out that the virus attacks these receptors around the heart and the lungs. It's called angiotensin converting enzyme receptors. So the spot where the angiotensin docks is where the virus invades. So you have elevated what's called angiotensins, which are very inflammatory. That starts destroying the tissues. And then you want your immune system to, remember the immune system and your inflammation are two different things. So you want your immune system to fight off the virus, but once the virus is in there, it's the inflammatory process that actually decreases the viral load. But when the immune system goes out of, when the inflammatory process goes out of control, again, for instance, in ankylosing spondylitis, the inflammatory process went out of control. And the COVID virus, when it goes out of control, it floods out the lungs, and people literally drown with this what's called adult respiratory distress syndrome. And that's a process for any reason people don't do well with. For 40 years, I've been in medicine. When people develop what's called ARDS, it's a high mortality rate of anywhere between 20 to 40%. So the COVID virus pneumonia is sort of the same thing. No different, no worse, no better, but it's also a serious problem. What Dr. Porges has taught us, and another friend of mine, Dr. Clausen, and several other major scientists have taught us, is that these cytokines, which unfortunately, I'm not saying unfortunately, I was very humbled by this process the last 3 months because the cytokines, we learned those in medical school, but I had forgotten about those. And so what happens is that those cytokines are the switches that turn the inflammatory process off or on. I always thought when you went into this fight or flight response that it was adrenaline and cortisol. Well, those don't come on board for about 15 or 20 minutes. What flips the switch is actually the cytokine saying danger. And then when the switch stays on, you get the inflammatory process. So what happens in the presence of this viral threat, these cytokines turn on and they don't turn off. So they flood out the lungs. So it turned out there's a bunch of things you can do to actually minimize the cytokine load before you get sick. So as this inflammatory process starts up, it doesn't hit the critical level that actually kills you. So there's also things you can do actually to decrease the cytokine storm. For instance, something simple like even IV ketones, which actually are neuroprotective and anti-inflammatory, are much different than glucose, which we traditionally give, which actually cause inflammation. There's ways of inhibiting angiotensin, so it doesn't cause so much inflammation. So there's about 15 or 20 different interventions you can do once you're sick to actually decrease the cytokine load.
Mm.
So we think that once we get this figured out, there's actually a reasonable chance that people will have a much lower mortality rate from the COVID virus, but there's still a lot of details to work out. It's all used in established medical practices. It's all a combination effect. But what I want to talk about here with your show is before you get sick, there's a bunch of things you can do to simply lower your inflammatory process. And it really affects degenerative disease, for instance, chronic pain, or chronic migraines, or tinnitus, or even adult onset diabetes, is that when you're under constant threat, anxiety, again, the legitimate anxiety about the COVID virus keeps your cytokines elevated.
Mm-hmm.
So if you do, so your immune system is compromised, then if you get sick, even though it's a legitimate concern, you still have a higher chance of going over that threshold that you'll actually die and not do well. So anxiety is a risk factor for not doing well with the COVID virus.
Okay.
So let me just review that one. Okay, so you have anxiety is a threat. So the threat is a mental threat. I'm worried about getting the virus. I'm worried about going outside. I'm worried about getting sick. I'm worried about dying. Those are legitimate concerns, right?
Yes.
That sounds psychological, correct?
Yes.
It's not. It's a threat.
Uh-huh.
And the response is a total body response to that threat. Remember, thoughts create the same reaction as the actual virus. So whether the elevated cytokines are coming from the virus, which is a threat, or from the thoughts, which are also a threat, anxiety is a response. It's not the cause.
Okay.
The mental threat, the thoughts are the cause, but the anxiety is the response. The anxiety represents the sensation generated by a threat. It represents elevated stress chemicals. It represents elevated cytokines. It represents elevated inflammation. But anxiety is a response. It's not the cause. Okay, so the big difference between the threat versus the cause. So and the problem is anxiety is an unconscious survival response. The unconscious brain processes about 20 million bits of information per second. Take a guess how much the conscious brain processes.
Way more.
40. No, it's 20 million per second, and the conscious brain processes 40. 20 million versus 40.
40. Oh, wow. That's...
You have no chance of actually controlling anxiety. And if you didn't have anxiety, you wouldn't survive. The first thing I tell people to do with anxiety is get rid of the term. It's not psychological. It's a physiological response. And just use the word elevated stress chemicals. So the first step in understanding how to deal with anxiety is you have to separate from it and realize it is what you have to survive. If you didn't have the survival response, you wouldn't survive more than a few minutes because you wouldn't breathe. You'd walk out into the street. You wouldn't protect yourself. So it's how every living creature responds is by having a survival response to a threat. Humans have consciousness, so we call it anxiety. My cat has the same response to a threat, but she has no name for it. The first step is understanding that anxiety is what you have to survive. It's not who you are. And it's sociopathic. It's amoral. And who you are is this conscious brain over here. But if your conscious brain identifies with this amoral survival response, it's a problem because it's overwhelming. People feel guilt, they feel shame, they have bad thoughts. All these things happen, but it's because of this amoral survival response. The first step in dealing with anxiety, let me ask you a different question, and you won't get the answer to it. It's sort of a rhetorical question. Okay, anxiety represents the sensation generated by elevated stress chemicals. If you didn't have it, you wouldn't survive, but it's 20 million versus 40, and you can't control it. It is not subject to rational interventions. How do you decrease anxiety?
It's the root cause, which is the thoughts. Because anxiety, it's the thoughts first, right? That's the thoughts is what is causing my anxiety, high stress levels. So
Right.
if I manage, it's the way I think. It's not controlling. I'm not suppressing my thoughts. I
Right.
want to, shift my thought process. I cannot
Right.
suppress it because you just told me by suppressing, you're not going anywhere because it's just suppressed and it could just burst out anytime. So I need to shift the way I think. Is that right,
Correct.
Dr. Hanscom?
Well,
Okay.
you're exactly right. The answer I was looking for is different, but that's an exactly right concept. Is that the answer I'm looking for is that, and I probably should word this differently. Okay, anxiety represents elevated stress chemicals. It's a response, not the cause. So the thoughts that you pointed out are the cause of the response. So the answer, the way to control anxiety is you decrease your stress chemicals. Now, you can't control it, so there's methodology to change them. So changing thoughts is one of the methods. Mindfulness drops stress chemicals. Relaxation, stress chemicals are down. Exercise, stress chemicals are down. But realize that you can't get rid of anxiety. You don't want to. It's there every day. So you learn how to process it and learn how to assimilate it into your life. Positive thinking is a disaster because it's another way of suppressing thoughts. And positive substitution, like you just mentioned, is critical. And you already know my lines so what you're doing, you're stimulating your brain to change through a process called neuroplasticity, which is awareness, separation, redirecting. You become aware of the negative thoughts, you create a space and separate, and you substitute. And I'm a strong advocate of what's called expressive writing, which simply write down these thoughts, throw them away. You throw them away for two reasons. One of them is to write with freedom, positive or negative, crazy thoughts, whatever they are. But the other reason to throw them away is to not analyze them. It's just a separation exercise. Remember, you can't control your thoughts. You can change thinking patterns, but you can't control it. So what you do with the writing exercise, the thoughts are on the table, you're here. So it's awareness separation in one move. And then reprogramming is like active meditation. You just put your brain on something different. Just drop your shoulders for a second, take a deep breath. But what I call active meditation is just putting your brain on a different sensation for 3 to 5 seconds. It does take extra time. You can do it multiple times per day. Then a meditation practice is great on top of that. I don't do that, but I strongly recommend if you have time to do 10 or 15 minutes of meditation a day. Again, you're calming down the stress chemicals. But probably the main message I want to leave today is that anxiety is a result. It is not psychological. There's many, many ways of lowering stress chemicals. But you have to separate from the reaction that is, again, it's what you have, it's not who you are. If part of your identity gets mixed up in this asocial, amoral survival reaction, it's your prison guard. In other words, anxiety is your bodyguard, but if it gets mixed up in your identity, it becomes your prison guard.
Mm.
We get imprisoned by our anxiety. So there's a bunch of ways. There's many, many levels to this conversation, but the essence of it is that the essence of chronic pain is your thoughts and inability to escape your consciousness. I call it the curse of consciousness. Then you have this ongoing, and by the way, when I talk to people in chronic pain, the bigger problem by far and away is they can sort of tolerate the pain, but they don't tolerate the relentless anxiety. It drives people crazy. And I know when I went through my chronic pain, I went from this fearless surgeon, the anxiety kept getting worse and worse and worse every year. The last 7 years of my chronic pain ordeal, it was a full-blown obsessive compulsive disorder, which is manifested by intrusive thoughts that become very vivid, almost visual. The harder you try to do battle with these things, it's a problem. Remember, any time you pay attention to a thought, you've now given it neurological attention. You've actually inadvertently reinforced it.
Yeah.
Anyway, it's a lot of techniques involved, but the essence of it is there's ways to calm your body chemistry. I wrote the book Back in Control, and the whole process is about safety. The essence of healing is basically feeling safe. safe from your thoughts, safe from other threats. And if you're not safe, physically not safe, then of course you need to do that. That's what anxiety is for. But much of what we're running from as far as our minds go are cognitive distortions, stories about ourselves, anger. Anger is a big one. So one of the ways you can decrease your cytokine load is learning tools to decrease your stress chemicals, like dealing with anxiety. The second one is forgiveness. If you're angry, guess what? Your inflammatory markers are way up because your body is really on guard. Okay. Expressive writing, we just talked about. Anti-inflammatory diet is huge. I didn't realize how big a deal that was. I've been very much of a diet cynic my whole life. Surgeons do not eat well. You can trust me on that one. I think you already knew that. And then, so it turned out this intermittent fasting that we talked about briefly before, there's a review article in the New England Journal of Medicine, which I'm happy to send you, that just reviews paper after paper after paper on the intermittent fasting. And the weight loss is one thing, but the effect on the inflammatory markers is profound. But what it does, it stimulates a ketosis, which is neuroprotective. They actually used to use ketones to treat epilepsy. But ketones are excellent food supply. They cut down inflammation dramatically. And the effect on inflammatory markers is just remarkable. I was blown away. Taking other activities are family issues. We've talked about family triggers. In other words, your family is generally, unfortunately, for all of us, your deepest triggers, and all sorts of family interactions that can be dealt with. One of the interventions we've talked about is simply never discussing your pain with anybody, especially your family. Anyway, there's lots of things you can do to actually lower your inflammatory cytokines before you get sick. If you get sick, as the cytokines rise, it won't cross that critical threshold. But that's the whole idea, is really learning to adjust to life, to minimize threats, especially the threats in your own mind, which is that endless self-critical voice. So the self-critical voice, again, it's you could call it psychological, but the problem becomes in that it becomes inflammatory. So it becomes physiological and then physical consequences. Anyway, I covered a lot of ground here. I'm not sure you were ready for all that.
Well,
I think I just gave you a very long answer to a short question.
No, that was excellent. Just to wrap it up, it all starts with our thought process, and where, it raises our inflammatory markers. Try not to associate the word anxiety with it. Say higher inflammatory markers and how to manage them. We don't have to manage, or we should not be suppressing our thoughts. You can start by doing expressive writing and then tearing the paper off and throwing it. That way you're also cutting off your emotion with that and not asking why question. Then doing some deep breathing, dropping your shoulders, doing meditation, and having good nutrition. That's a huge piece, nutrition. And we have seen some evidence that intermittent fasting also works with lowering the inflammatory process. So we are not trying to anxiety is not our enemy. It's actually, it protects us. But if it's chronically stays up, that's when it's a problem. So we always need to try, whether it's during this time of COVID or not, we need to work on these practices so that our thoughts processes are not elevated, and it does not elevate our stress hormones.
Right. Exactly. Very good.
All right. Thank you.
You didn't need to interview me. You just actually said everything. You really know.
I just repeated what you just said.
We have a couple more minutes here. I just want to say a couple more things, if you don't mind. There's a couple of curveballs here.
Yeah.
Okay. The question is, including myself, I'm not lecturing here, is that we all know ways that we should be living healthfully, right?
Yes.
Why don't each one of us do that? Why are so many people unhealthy? Why would we do that to ourselves? We know better. All of us know that good diet, nutrition, exercise is a good thing to do. Why don't we do that?
Because our palates are used to, all this fast food, or we want everything easy on our, we are driven to that fast life. We wanted everything easy, right? Because whatever is easiest, we have had so much of innovation, with that being said, where do we even go out for a walk much? You just sit at your computer, you sit in a car, go someplace. So there's not much movement. And as humans, we want whatever is easy. We don't want to work harder, I think.
Well, I agree with that. And that's also survival emotion too. In other words, you're going to solve the problem as quickly as you can because it conserves energy. I mean, that's a survival reaction also. But the other issue I was looking for is that it's the anxiety that actually blocks us. Because remember, you have elevated inflammatory markers. You are trapped by anxiety. So people become angry. Remember, anxiety and anger are the same thing. In other words, you're trapped. Your body secretes more stress chemicals in order to solve the problem. And they find out when people are trapped that you have ongoing inflammation. And you also develop what I call obsessive thought patterns. In other words, you're in a victim role. You feel sorry for yourself. Anger is destructive, but it's also self-destructive. So I never could figure out for decades, how could people completely neglect their health? And the problem is they have no choice. In other words, you have these obsessive thought patterns that are not rational, and you can't reason through them. All of us do things that we know better that we shouldn't be doing, but we do them anyway.
Mm-hmm.
It's behavioral patterns that drive us. And what we want to do, there's relentless anxiety that we can't deal with. So it turns out we become addicted to anger. There's actually a dopamine surge when you get an anger hit. So we become addicted to anger. The patterns become very ingrained. So unfortunately, the disease process that creates these circuits in our brain that you can't change and are permanent also blocks the treatment. So we rationally know that we should be behaving better and acting better, but the behavioral patterns always win. You cannot outrun your mind. And that's why you have to make sort of a choice that you can't fix yourself because your choice is on the problem, not the solution. And I'm going to go back to the expressive writing just for a second. That is the only part of the whole healing process that's mandatory because it sort of breaks that crack. In other words, you just put a foot in the door. It's not the solution. It's just an exercise. It is not psychological. What I didn't realize, there's a book I have in my hand called Opening It Up by Writing It Down by Dr. Pennebaker. And he documents over 1,000 research papers, talks about its effect it has on the body. So for instance, wound healing. People heal their experimental wounds twice as fast with expressive writing. In the HIV epidemic, the viral load dropped down with expressive writing. Oh. People with rheumatoid arthritis and asthma have marked resolution of their symptoms with expressive writing. There's actually more of an effect on physical symptoms than there are mental symptoms, even though anxiety drops, depression drops, school performance goes up, quality of life goes up. And for me personally, after my 15-year ordeal, the only thing that pulled me out of my tailspin was expressive writing. Now, why is that? I went to psychotherapy for 13 solid years, which I'm not against, but I kept getting worse. But I kept analyzing my thoughts. I knew everything about my past you can imagine. But what I didn't understand by paying attention to my past, I was actually reinforcing it. And so what the expressive writing does is simply separates you from that, and you start moving forward. One metaphor I use is unhooking from a train. Just visualize yourself being the engine of a very long train, and all the expressive writing does is simply unhook you from the past. Done. Now you're free. You may be free for 5 minutes or a day or a week. It's just an exercise that's really critical. Again, there's hundreds and hundreds of research papers documenting its effectiveness. Why don't we all do that? It should be part of the human experience, and simply write down your thoughts, tear them up. Could be a minute, could be 5 minutes, could be longer. It's like brushing your teeth. It's like keeping your brain clean. And it couldn't be simpler. I did my expressive writing a few minutes ago. I've been doing this for about 15 years. If I quit doing my expressive writing, in about 2 weeks, my symptoms come back. My ears start to ring, my feet start to burn, these little skin rashes pop up, I don't sleep as well. So I still have a certain amount of disbelief that something so simple could have such a profound impact. Almost every patient that I saw, hundreds and hundreds of them, always started with the expressive writing. They didn't really break free and start moving forward until they could actually let go with the expressive writing.
Wow. So with the expressive writing, so just write any thoughts that come to your head, whether it's positive, negative, doesn't matter. Just start writing it down and then tear it up.
Right. And it's not a catharsis. Remember, there's trillions of thoughts. You're not getting rid of these things. You're just simply separating. That's it.
Okay. So by doing that, as you said, emptying the thoughts out of your brain, similar to emptying your trash can. Every day you want to keep the trash can clean, right? You don't want to build up all the thoughts and keep.
Well, I want to change that metaphor a little bit, because again, you're not catharsing. You're not getting rid of the thoughts. I mean, there's trillions of thoughts. Trillions, right? So it's to me, it's sort of a metaphor that your thoughts are here, you're here. So there's a separation that occurs. There's a space that's now connected with vision and feel. With the thoughts on the table, you're here. That's now connected with the unconscious brain. So to me, it's sort of a metaphor for separation, because if people write and they write and they write and they go, well, I'm not getting any better. Well, it's not the solution. And I also encourage people not to write more than once or twice a day, because what happens, people will grab a piece of paper, they have an unpleasant thought, or they get upset and they'll start writing, they'll write, and they'll write. Well, that's a fixing mindset. I'm going to fix these thoughts. I'm going to get rid of these thoughts. So remember, the way you solve the problem is you feel safe from the thoughts, which means you get to coexist and live with them. As you train your brain to quit reacting to them, then they start losing their power. Remember, what you resist will persist, right?
Yes.
Okay, so if you're resisting unpleasant thoughts, guess what? You've given them power.
Yeah. Yeah.
Right? So again, going way back in the conversation, the essence of life is feeling safe. We're programmed to avoid threat and gravitate towards safety. So what the tools do in the Doc project is they allow you to feel safe. It's a learned skill. Psychology comes into it, but it's not primarily a psychological issue. And as you know, you and I have talked a long time, and I know you've had a lot of benefit yourself from the concepts, but it's not very hard, and it is a process, and it's never any, quote, beginning or end point to it. It's just a day-to-day ongoing learning process. But for me personally, it's been incredibly helpful. For my patients getting better without surgery, it's been incredibly helpful. When we do surgery, the outcomes are dramatically better. And I just realized yesterday, by the way, when I started realizing the effect of these cytokines on wound healing, and that the expressive writing probably, well, it does, it works through the cytokines, that I had almost zero postoperative wound infections the last 6 years of my practice when we started doing these tools before surgery, every patient, every time. But I didn't really connect the direct effect that these activities had on the immune system and cytokines.
Mm.
So again, what you're doing, quote, psychologically, is having a very major direct impact on your body's inflammatory process and your tissues, and your capacity to heal.
Heal fast, yeah.
Right. So it's really clearly a direct link. And so it's been really a remarkable, eye-opening experience for me here the last few years.
Wow. Yeah. Since I have been working with you, I have seen tremendous changes, much
Pretty fun, huh?
improvements in me. Yeah. And I do use these doc project strategies in my coaching sessions too.
Oh, good.
So that's been very, very helpful for me. So since we were talking about anxiety, the stress levels and all that, yes, it is, as you were saying, it's not psychological, but as we know, majority of them, say I have an anxiety disorder, and they go to a physician and they get all these medications prescribed.
Right.
So what's your thought process on that? Do we need medications to, to manage or to get our inflammatory process down?
Well, remember the essence of healing is feeling safe. And unfortunately, in this day and age, that we don't have time to spend with their doctors, so we don't feel safe. People get rushed through the practice. I mean, I'm not saying there's not many exceptions to that, but that's one of the problems, that we're not feeling safe with our doctors. So the answer is yes, you can use medications in the context of the other tools. In other words, 20% of the doc project, which stands, by the way, for direct your own care, is medications. So if you're on opioids, I would keep people on opioids. And as they started to calm down and relax, why they would drop the opioids. So same thing with anxiety. The drug I actually used when I was doing this by myself was Xanax, benzodiazepine, Valium, which works beautifully for getting people off of opioids. And I understand there's an overlap of respiratory depression with both drugs, that a lot of people with overdose deaths have taken both drugs. So in this day and age, it's not as easy to use as it was 30 years ago. However, a friend of mine in North Carolina uses CBD, which also has nice anti-anxiety properties and sleep and anti-inflammatory. And he's doing a lot of hard work with a molecular biologist. He's had a tremendous success in his clinic using the doc project for his group therapies, using CBD instead of the benzodiazepines. And I'm not a CBD expert. I never will, because I'm not in practice anymore. But the safety profile of CBD is much better than with opioids. And so that's something to consider, again, under the doctor's supervision. Self-medicating probably is never a good idea. But yes, medications temporarily while you're healing are very helpful.
Okay, so, but not for the long-term process. And what you had just brought up about the CBD, instead of, the opioids or something, they can do the CBD, but as they're doing the doc process, expressive writing and all that practice, can
Right.
slowly come off of that CBD.
Correct.
Is it, I mean, I know you said you're not an expert in it, but just quick question. How safe are the CBDs to be using for long term? Because now CBDs are advertised everywhere. Anytime you have any problem, they say, here's a CBD for you to fix that problem.
Right. And that's a problem. I mean, again, we find out that in chronic pain, again, mental pain being the bigger problem, is that if you're everything works a little bit in chronic pain, but nothing works in isolation. So yeah, CBD helps, expressive writing helps, sleep helps. It's when you combine those things together, when things start to work. So CBD gives you relief for a few months while you get better, maybe a year, even a year or two. Great. But if you're using CBD to solve your pain, it's not going to work. If you're using CBD to decrease your anxiety a little bit and help you sleep while you do the other things, then it can work beautifully. So any intervention, including expressive writing by itself, is not going to fix you. Remember, you're connecting to your own capacity to heal. You're allowing yourself to heal. You're not fixing yourself. So whatever you use, if you use it in the context of part of an overall process, I think CBD is a pretty good choice. There's not, again, I'm not an expert, but the safety profile seems really high, and the addiction potential seems actually quite low. It doesn't have the THC, which is the marijuana type, mood elevator. So yeah, it's a choice to consider.
Okay, and
Not
use it as a combination, not one or the other. Right. So what is the one advice you would leave our audience with? We have talked about many different tools. What's the one key thing? I think you did mention that a minute ago, that you want our audience to start working on it.
It's about connection, connecting to who you are, which includes negatives and positives. We all have anxiety, frustration, and anger. We all also have compassion and the desire to do well. So as you connect with who you are and what is your dark side and your light side, then you can start to relax and feel safe. And once you learn to feel safe with yourself, taking full responsibility for your own life, that's your one responsibility on this planet, is to take care of yourself. And of course, you start taking care of people around you that are close to you, then the ring starts getting bigger and bigger. But the number one thing is let yourself be kind to yourself. It's a learned, trained skill, and it's not very hard. So it's about safety.
Safety. Okay. Love yourself. Take care of yourself first.
Right. Yep.
And to understand those, you can do the expressive writing. That way you know your feelings and the thoughts
Right.
that are going through.
Yep.
All right. Great. Thank you very much, Dr. Hanscom.
Yeah,
so
thank
where
you.
can the audience find you if they need to follow up with you?
There's a website called backincontrol.com, one word, backincontrol.com. Then on the website, there's a link to every Tuesday and Thursday from 12 to 1 o'clock Pacific time. I have an open question and answer period. And so it's fun. We have a group of people. We go back and forth. This is very much of a self-directed process, but the additional coaching makes a big difference. So we've had lots of people do really nicely on that little round table. So I encourage people to hop on the phone and just hit the link and you're on the Zoom meeting instantly. And then the book is Back in Control, a Surgeon's Roadmap Out of Chronic Pain, which gives you a nice background to what's going on. If you're considering spine surgery, the book, Do You Really Need Spine Surgery? Take Control with a Surgeon's Advice, will give you a very clear picture about who should and should not have surgery. And so those are the resources that we have right now.
Okay, wonderful. Thank you. And the link to that live chat is on your website for people.
Yes, it's in our calendar timeline. It says Questions and Answers with David Hanscom. And yeah, just pop on.
All right. Okay, thank you very much for your time. It's been a pleasure.
Thank you. Okay.
All right.